Hey everybody, it's Dr. Martingano again. I know it's been a while since I've been on here, but I keep reading what's going on in the headlines right now. Today's June the 30th, and we're here in Florida, and I'm watching what's going on in the news. I'm watching what's going on in the public. I'm watching what's coming into my office, and I wanted to get back on here and take a minute to just reassess what's going on and give you guys some more truth and some more fact-based information on what really is going on out there. Here in Florida, what we keep hearing is just bad news. The headlines are like the number of cases are going crazy, and it's the resurgence, and every day it's a record-breaking thing. And I'm going to filter through that and tell you what's really going on. Where are those numbers coming from? What do they represent? What do they mean to us? And how does that affect us day to day? What are they testing for? We're going to go through all that in a quick bit of time here. So I'm going to start with you guys with a couple of headlines that I just pulled up just to see what you guys are watching out there and listening to. This is from CNN. What's behind the surge of COVID-19 cases in Florida? What's behind the surge? Like, where's this coming from? This one's from MarketWatch. Coronavirus update. Global COVID-19 cases tally top 10 million in Florida, South Carolina, and Nevada set daily records. Like, Florida's like we're the worst. If you're watching the news and you're not from Florida, you would think there's dead bodies littered in the streets. It's Florida's the worst of the worst. As Florida coronavirus cases skyrocket, gyms nervous about their fate. That's from local news 13, implying they're going to start closing things down again, closing down the gyms again, closing down restaurants. We've already closed down bars again because apparently coronavirus goes to bars, and that's where we get it from. Florida COVID-19 cases up 5-fold in 2 weeks. The numbers are scary. That's from the New York Times. Business Insider says a Miami ER doc explains how coronavirus in Florida response went from success to disaster. That's what you guys are hearing out there. Headlines are like, "Oh my God, we are doomed. We are stuck." So let's talk about what are they covering? What do cases up mean? So cases up, the number of cases is what they're reporting on. Number of cases just means the number of people that have been tested. So if we think about it, the whole point was we're trying to test more people. You're going to test more people, you're going to get more numbers. So that being said, there's two types of testing that are going on. So we're going to break it down a little bit. The two type of tests that are going on, there's one called a viral test, or what they call the PCR test. The PCR test is a polymerase chain reaction test. That's a viral test. What that is, the nose swab, like you've seen it on the TV. They take the nose swab or saliva swab, and they're looking for, do you have coronavirus evidence in your airways? The other one is a serological test or a blood test. They're testing for antibodies. So the difference between the two is that the antibody test uses blood samples. They look for biological signals that you have been exposed to the virus. The viral test is, are you currently having the virus in your system? So the point is, a positive on a viral test and a positive on an antibody test, they mean two different things. They don't mean the same thing. One positive is not the same as the other positive. So this is from Professor Ashish Jha from the Global Health at Harvard, the director of the Harvard Global Health Institute. Here's what he says. Viral testing is to understand how many people are getting infected, while antibody testing is like looking in the rear view mirror. How many people have been infected? The two tests are totally different signals. He says mixing the two tests makes it much harder to understand the meaning of what a positive test means. The combining of the test could lead to the skewing of the overall positivity rate of the test, a measurement that is one of the benchmarks used in the reopening guidelines by the White House and the CDC. Mixing these two tests skews the positivity rate. One positive, the viral test, means these are how many people are actively getting infected. The antibody test is how many people have been exposed and have antibodies and now have the antibodies in their system. That number, you want as high as possible. That's good. The whole essence of giving a vaccine the shot for this is to build up antibodies so that you now become immune. So anybody who has antibodies, that's a good thing based on their own standards. But they're taking the two numbers and they're combining them together, and then they're reporting on cases are rising because those numbers are going up. So mixing the two tests makes it harder to understand what a positive test means. Now, going on that, this was published in The Hill. This says, CDC acknowledges mixing of coronavirus data. So the CDC says, oops, we've mixed up the data. Here's what they said. The agency confirmed on Wednesday that it is mixing the results of viral and antibody tests, even though the two tests revealed different information used for different reasons. So the CDC, who was reporting these things on a government level, on a national level, they say, yeah, we were mixing these two. We didn't realize it, but yeah, we are. They said several states, including Pennsylvania, Texas, Georgia, Vermont, Florida, and others, are blending the data in the same way. So here's where it breaks down to different states, and this is where it gets just silly. Virginia likewise mixed viral and antibody tests until last week, and then stopped it when the governor apologized after it was covered in the Richmond Times. So they were doing that. The Richmond Times covered. The governor was like, "Oh, sorry, we shouldn't be doing that." Maine similarly did the same thing on Wednesday, and Vermont authorities said they didn't even know that was happening. They had no idea that they were doing that. And then in Florida, which is where we are, Florida, her name was Kristen Nordland. She's a spokesperson for the CDC. She said that she told us the inclusion of antibody tests in Florida is one reason why the CDC has reported hundreds of thousands more positive tests in Florida. So what are they saying? These two tests are totally different things, but they're taking the numbers, they're putting them together. You're getting a very, very high number of positives. What you want is a very high number of positive tests, meaning people are building up antibodies. When they're building up that antibody test and combining it with the other one, it basically means nothing. So ultimately, if we're testing, what are we testing for? We're testing for how many people are getting infected, but ultimately, how many people are going to die from this? Not how many people get infected, not how many people have contracted it, not even how many people are going to the hospital for it. Those numbers aren't big, they're tiny. We have a doctor friend, she said there's like 6 people in the hospital. It's nothing. And that's here in Brevard. We're looking for how many people become infected because we're afraid that these infected people are going to die. We're going to overwhelm the hospitals. It's going to be tragic. It's not happening. This is from the CDC. This is the CDC's provisional death counts. So what they do is they measure this stuff every week. So provisional death counts, this is a chart that you can look up right on the CDC. This was updated June 30th. This was updated today. This column right here, this is the number of deaths per week for every period they have. Now, the inclusion of deaths, it says all deaths involving COVID-19. Down here at the bottom, they're telling you the deaths that they put here, the deaths with confirmed or presumed COVID-19. Doesn't take a laboratory test to confirm that. If the doctor says, hey, it's COVID-19, it's COVID-19. That's another conversation, but these are the death numbers. Back in February, it was 0, 1, 5, 5, 33, 52, 300, 3,000, 9,000, so it started getting up. In April, 16,000. Later April, 14,000. Then May, 11,000, 10,000, 8,000, 6,000, 5,000, 4,000. June the 16th, 2,000. Here's the latest number down here. The latest number of last week, 153. 153 people. That number is plummeting. That's the number of people who are dying. The number went like this and just like that. Who cares how many people are infected out there? Who cares how many people are testing positive? 157 deaths last week. That's nothing. This is over. There's no second. This is nonsense. You're getting these reports. They got to keep us afraid. They got to keep the numbers high. They got to keep these headlines. What's going on in Florida? We're all going to die. The numbers, and that's nationwide. That's not even Florida. Here's Brevard County. This is total over. This is not last week. This is Brevard County. Brevard County. Total number of deaths, less than 20. On this paper, what they do, they have a grading range. 0 meaning no deaths. The next category is less than 20. Not even 20 people. That's where Brevard falls. Not even 20 people. As a pointer, like last year, there were more than 75 just opioid overdose deaths. There were less than 20 people. So this is not something that you need to be worried about. This is not something that you need to be afraid of. The numbers are down. They're gone. It's nothing. It's gone. The number of cases are going to keep getting reported because we're doing more testing. We want more positives. They're blending the numbers, but the number of people dying is dropped off. We do not need to be afraid. And for this, we're shutting down economy. We're closing down business. Guys, it's over. Get back to life. Get back to what you want to wear a mask. You want to protect your people because there's people out. That's totally cool. That's what you're supposed to do. But let's stop with the fear. Let's stop with the we can't go out. Let the numbers. Stop watching the news. The media just takes these numbers and says, hey, hundreds of thousands, Florida's dying. And we read the headlines. It's nonsense. So we know what we're doing this week. We're doing our Patient Appreciation Week because we want to celebrate life. We want to get people back out. We want to celebrate going back to normal. 4th of July is coming up. That's our independence. That's going to be this Saturday. I mean, we're having a party for all of our patients and all of our friends and families. We're going to be here Saturday afternoon here. Come by, swing by the office, but I haven't been on in a while because I don't want to keep reporting negativity. I try to give you guys some stats and some facts, but the way the headlines are going, the way the media is going, I just can't stand it. So here we are. There's the facts. There's the numbers. CDC's mixing numbers. We're getting the things pumped up, but the reality is it's dropping off. It's gone. It's done. We're done with it. Let's move forward. So I love you guys. Glad to be back on here. Give you guys some nice stuff. Comment. Give me anything you want to know. Ask me any questions. We're going to be here all week. Come swing by. Say hi. We're going to have a party on Saturday because it's the 4th of July. Come by early afternoon. Call the office. We're going to have food. We're going to have fun. It's going to be awesome. But stop being afraid. It's over. We're done. We're good to go. See ya.